Okay, so sorry about that. We had to stop it so that I could be sure that I had a small enough file to upload it to YouTube. So now I'm going to do the irrigation and removal of the nasogastric tube. So let's say I went out and I came back a few minutes later and I can see that there is no fluids or anything coming out of the suction device. So what I want to do is, the first thing is to perform a GI assessment. So I want to just listen to all 4 of the quadrants and see if I can hear any vowel sounds. And I also want to see if the abdomen is distended. In my physical assessment, my patient's abdomen is very distended, so I'm assuming that it's blocked somewhere within the tubing. So the next thing that I want to do is perform my checks. First I would turn off the suction, and then I want to get 5 to 10 cc's of air once again, and I want to put it into the clear tubing. While I'm trying to insert the air in, I would be listening over the fundus of the stomach to see if I can hear a swishing sound. As it is, I can't even get the air in, so the next thing I would try is to aspirate 5 cc's of fluid, which I can't even do that. So I know that it's blocked somewhere in the tubing. So what I want to do is I would get a new syringe. So this is my new syringe. Let's pretend this is my water cup over here. And what I want to do is I want to withdraw 30 cc's of water. That's pretty standard, but I need to check with the facilities guidelines to see how much they would want me to do. I would hook this up to the clear end, and I would hold the tubing and the syringe in one hand, and with this hand I would be using a pumping action to try and get that blockage out of the tubing. And now I felt that went through, so that's good. I know that it's clear. The next thing that I want to do is get rid of this. I would get a new syringe. I want to do my checks again to make sure that it's actually in the stomach. I would make sure that I could hear air over the fundus of the stomach and possibly check the pH again. That's all good, so I know that it's flowing properly again. So I would hook the suction back up, turn it back on, then I would get 5 to 10 cc's of air with the new syringe, and I would insert it into this little blue tubing to get the tubing away from the wall of the stomach. I would do that inserting the air into the stomach every time that I turn off the suction to make sure that the tubing isn't sucked up against the wall of the stomach. So that would be my irrigation. I would make sure that the patient was all good, and hopefully, well, it should have relieved the abdomen distension, and I should still be able to hear the vowel sounds. Okay, so blah blah blah. Now I'm going to come back in, and let's say that I'm going to be performing, removing the tubing. It's going to be kind of hard to do with my person's paper nose. I'm probably going to peel up his nose with the tape. Anyway, so I have the doctor's orders to remove the tubing. So the first thing that I want to do when I come in is I want to do my checks again. So I would turn off the suction device, and I would perform my checks. 5 to 10 cc's of air into the tubing. I would listen over the fundus of the stomach to the left of the xiphoid process. As I put the air in, I would hear a swooshing sound. That's good. Then I want to aspirate a little bit of the stomach contents, under 5 cc's. Check the pH of that. If it's under 4, then I know that it's good and on the stomach. So yeah, that's all good. And now I'm going to be performing the discontinuation. So I have a new syringe here. This is my water. And the first thing that I want to do is I want to put 20 cc's of air into my syringe, and then I want to do 20 cc's of water. So if I'm holding my syringe up right, I have the 20 cc's of air here and the 20 cc's of water down here. And that's pretty standard for most facilities, but I would make sure that that was with my facilities guidelines and everything. So I want to hold my syringe upright, and I first want to flush the tubing, get all of this black stuff and whatever out of the tubing with the 20 cc's of water, and then I would push the air through, which would push out the water down into the stomach. I would leave this connected on the patient's chest. Then I would disconnect take off the tape. I would hold the tubing. I would ask the patient to take a deep breath and hold it so that they wouldn't aspirate any of the contents that would be coming out of the tubing as I was taking it out. Using a hand over hand, I would pull that right out and I would get that out of the way, and I would offer the patient, if they needed to feel like they needed to gag or throw up or anything like that, and offer them a drink. I would perform mouth cares as I needed to, and then I would also go in and I would do my documentation about doing the removing procedure, and that would complete my skill.
Good job.